Have you ever noticed tiny spots or squiggly threads floating across your vision, especially when you look at something bright, like a blue sky or a white wall? If you have, you're not alone. These little floaters are pretty common, especially as we get older. But what exactly are they? And do you need to worry about them? Floaters are those shadowy shapes that sometimes drift through your field of vision. They might look like specks, cobwebs, or wavy lines that move around when your eyes shift. They can be distracting, but most of the time, they're harmless. Still, it's natural to wonder if there's anything you can do about them. Floaters happen when the gel-like substance inside your eye, called the vitreous, starts to thicken or shrink as you age. As the vitreous changes, tiny clumps of gel or fibers can form, casting shadows on the retina. Those shadows are what you're seeing as floaters. For most people, floaters are just a minor inconvenience. But sometimes they can be a sign of something more serious, like a retinal tear or detachment. So what should you do if your floaters are becoming more than just a nuisance? The first step is to get your eyes checked by an eye doctor. They can figure out whether your floaters are just part of getting older or if they're something that needs attention. If your doctor determines they're harmless, there are a few treatment options, although none are perfect. The simplest approach is to wait and see. For many people, floaters tend to settle at the bottom of the eye over time, making them less noticeable. If they aren't really getting in the way of your day-to-day life, this is often the best option. But what if they're more than just a mild annoyance? There are two main medical treatments: laser therapy and vitrectomy. Laser therapy, known as YAG laser vitreolysis, is a non-invasive procedure. It uses a laser to break up larger floaters into smaller pieces that are less noticeable. It's usually quick and easy, but results can vary. Some people see a big improvement, while others might not notice much difference. It's also important to know that laser therapy isn't without risks. There's a chance it could damage the retina or other parts of the eye. So it's usually only recommended if your floaters are seriously affecting your vision. The second option is vitrectomy. This is a surgical procedure where the vitreous gel, along with the floaters, is removed and replaced with a saline solution. This can be very effective, but it's not without its own set of risks, like infections, retinal tears, and even cataracts. Because of these risks, vitrectomy is typically reserved for severe cases where floaters are making it hard to see clearly. If you'd rather avoid surgery, there are other ways to manage floaters. Making small changes to your environment can help. For instance, if your floaters are more noticeable in certain lighting, try to avoid those situations. Some people also believe that taking antioxidants like vitamin C and E can help. While there's no solid evidence that these supplements reduce floaters, they do support overall eye health. It's also a good idea to stay hydrated and maintain a healthy diet. Keeping your eyes well moisturized and nourished can sometimes make floaters less bothersome. In recent years, some people have turned to natural remedies like eye exercises or herbal supplements. While these might sound appealing, there isn't much scientific proof that they work. If you're considering alternative treatments, talk to your eye doctor first to make sure they're safe. The bottom line is that for most people, floaters are more of a minor annoyance than a major problem. But if you ever notice a sudden increase in floaters, flashes of light, or a curtain-like shadow in your vision, get medical help right away. These could be signs of a retinal detachment, which is an emergency. In summary, while floaters are a normal part of aging, they don't have to control your life. Whether you choose to live with them, explore medical treatments, or make simple lifestyle changes, the choice is yours. If you found this information valuable, please give this video a thumbs up, share it, and subscribe to our channel for more insightful content. As always, take care of yourself, and thanks for watching.